My name is Charlie Vander Horst, and I'm a professor of medicine at the University of North Carolina. If you look at a map of the states in the United States, or hone down and look at the counties with the worst health statistics, North Carolina ranks at the bottom, and some of our counties are at the bottom. If you look at syphilis rates, several counties in North Carolina were in the top 10, and certainly cardiovascular deaths are terrible, premature births are terrible, diabetes is terrible. There's a couple of reasons there. One is because we have a barely functional public health system that's overwhelmed. But the larger issue is that we have 300 to 500,000 working North Carolinians who are below the federal poverty level and who don't qualify for Medicaid. And for want of health insurance, that means they can't get preventive care. Then they end up clogging our emergency rooms and getting admitted to the hospital with catastrophic illnesses. So the Affordable Care Act, if we had expanded it, we would have provided that preventive care to these folks. I'll give you an example. I had a guy who I admitted. He was a farmer from rural North Carolina, and he came in. He'd lost an enormous amount of weight over the previous 8 months. He comes in gaunt. He looked like he'd been out of a concentration camp, and he'd had difficulties swallowing, and we diagnosed him with having esophageal cancer that had spread to his liver. He was actually literally dead within 5 days of admission. We couldn't even get him out to hospice. And I asked him, why hadn't you come in early? Because obviously he'd have been having symptoms for months, and because he didn't have health insurance. He's a white, conservative, working farmer who died needlessly for want of health insurance. The estimates are there have been 2 studies that among those 300 to 500,000 people, anywhere from 1,000 to 2,000 people will die every year for want of the health insurance. I do want to touch on this whole issue of morality, because I've been criticized, including by my rabbi, about the term morality. And it really bothers me. There is a right and wrong. My grandfather, grandmother, and aunt were murdered by the Nazis in 1942. And if in the 30s, if there had been more people talking morality, and that what the Nazis were doing was immoral, maybe that never would have come to pass. So there is a thing right and wrong. For a governor or the Speaker of the House, Tom Tillis, to allow the death of 2,000 people, then we need to speak out, stand up, and call them for what they are, and that is immoral.